Start? Okay. Good afternoon, everyone. I'm Mona Zafanti, the Winnebago Public Health Administrator, and we will be presenting some corona preparedness and response. And Angie Keller, our Public Health Nurse Director, will start our presentation.
Good afternoon. We're just going to go over a couple of things with the coronavirus and what the community is doing for the response. So with what the coronavirus actually is, it's a disease or respiratory illness that can spread from person to person. The virus is also known as COVID-19. It's a new virus that was identified in Wuhan, China. It's a large family of virus. The difference between this one is it has, since the previous families of the coronavirus have not yet been able to go from an animal to a human and then get infected to other humans. This is the first new virus that is able to do that. It originally started with bats and then infected an animal, which then was ingested by a human, and then now it's spreading from human to human. So that's the area of concern surrounded around the coronavirus. The illness, the symptoms related to the illness are respiratory-wise, and they can range anywhere from mild to severe, and there have been some confirmed cases of death caused by the coronavirus. The coronavirus statistics, the state health labs are now testing for the COVID-19 viruses. There is limited capability for the state of Nebraska to test for that, so they are screening all individuals that are coming in to see if they qualify for the testings. Currently, 54 states and U.S. territories have reported cases of the COVID-19 virus to the CDC. Of those cases, they include transmission from travelers, so when an individual traveled to a community where there is known cases, where there's confirmed cases from close contact, so an infected individual is in close contact with somebody else and then that person becomes exposed, and then community acquired, which there is no known source of infection. The total cases as of today in the U.S., there's 7,038 cases. Total deaths in the U.S. from the coronavirus is 97. The jurisdictions reporting the cases are 54. The U.S. travel-related cases are 269. Spread from person to person or close contact is 276. Cases that are still under investigation are 6,493. There are 27 known cases in Nebraska. 2 of those are community spread. And then there has been a total of 240 negative cases. Currently, there is no known cases in the Winnebago. The symptoms of the coronavirus are respiratory related. The most common are fever, cough, and shortness of breath. Symptoms can appear anywhere from 2 to 14 days after exposure. We do ask that if anyone is developing any of those symptoms, we want you to contact your healthcare provider or the Winnebago Public Health Department to kind of have them triage your symptoms to see if it's something that can be taken care of at home or if there is medical treatment that is needed. And then we also want you to seek medical advice if you do develop those symptoms and you've been in contact with somebody that is known to have the virus. Who's at risk? The people that are most commonly at risk are those of older adults, 65 years of older. People that have serious chronic medical conditions, those can include heart disease, diabetes, and lung disease. And then if you're at higher risk from developing the serious illness from COVID-19 infection because of the age or because of any medical conditions, it is really important that you do take actions to minimize your risk of getting exposed to that virus. And then if you are at higher risk, there are certain things we would recommend you doing. One is stock up on supplies. You want to make sure you have enough supplies within your home to let you carry on your day-to-day activities. Take everyday precautions, and we want you to kind of practice social isolation. So just make sure you're trying to distance yourself from others just within proximity. We recommend 6 feet or more away from other individuals. And then when you go out in public, please make sure to stay away from anyone that's sick and limit your close contact with them. And then if you do come with contact with them, make sure you do wash your hands effectively. We want you to wash your hands for 20 seconds, and if soap and water is not available, then to use hand sanitizer. To avoid crowds as much as possible, avoid any non-essential travel, that includes cruise travel, and then travel within and outside the U.S. And then during the COVID-19 outbreak, we do ask that you stay home as much as possible, and that's just to promote or to prevent you from getting sick, and then to reduce your risk of being exposed. Everyday precautions that individuals can take is to avoid close contact with people who are sick, clean your hands often, wash your hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing, or having been in a public place. We do ask if you do have to cough, sneeze, or blow your nose, use a tissue and then dispose of that tissue immediately, and then immediately after that, washing your hands. If at any time soap and water is not available, we do recommend that you use hand sanitizer that includes at least 60% alcohol. Everyday precautions that individuals can take. To the extent possible, avoid touching any high-touch surfaces in public, so doorknobs, elevator buttons, light switches, handrails. Try to avoid handshaking. One good barrier to use is a tissue or your sleeve to cover your hand, fingers for something that you touch, and then immediately wash your hands afterwards. And then try to avoid touching your face, nose, or eyes. Other everyday precautions that individuals can take is to clean and disinfect your home from any germs. Practice routine cleaning to frequently touched areas within your home. That includes tables, doorknobs, light switches, handles, desks, toilets, faucets, sinks, and cell phones. Avoid any crowds as much as possible, especially those in poorly ventilated areas. Try to make sure if you're going into a crowd, there's enough space that you can keep your social isolation space at 6 feet, and then especially if the area is poorly ventilated. Avoid any non-essential travel, such as plane trips and especially cruise trips, and that is now recommended outside and inside the U.S. Reducing the risk of the spread of the COVID virus. It most commonly is spread from person to person, and that is within close contact, so less than 6 feet of space via respiratory droplets. That's why we want to push and recommend following that 6 feet distance from other individuals. There's evidence that suggests the COVID-19 virus actually remains on surfaces for hours. So you want to make sure if you're touching any public surfaces or hard surfaces, you are washing your hands afterwards and then cleaning those areas as well. If there's any visible dirt on a surface, it is better to clean that with soap and water first and then disinfect it. That allows for the disinfectant to actually reach the surface. There are numerous disinfectants available on the CDC website, but you want to make sure that they are EPA approved. And then you want to handle the disinfectants as directed on the label. And then things you should do if you become sick. We want you to stay home except to get medical care. You want to separate yourself from other people within your home. If you do feel like you need to seek medical care, we do strongly urge you to call your provider or the doctor's office or the public health department before seeking that, so that way we can prepare everything that's needed for you to come in to keep you safe and then to keep everyone safe that's already there. We ask that you wear a face mask when you're around people, clean your hands often, cover any coughs, sneezes with a tissue and then dispose of it immediately, followed by washing your hands. Monitor your symptoms, and if symptoms worsen or are prolonged, we do want you to call the provider or the health department so we can walk you through what the next steps would be. There is a hotline available for anybody that needs assistance with questions or related to the COVID virus. That number is 402-922-1508. And the last thing, we do want you to seek medical treatment if your symptoms are worse. And then if you are going to seek medical treatment, or what to do if you do seek medical treatment, if symptoms worsen and then you have increased difficulty breathing or shortness of breath, we want you to call your healthcare provider so they can get everything ready for you to come in. If there's any persistent pain or pressure in the chest, any new confusion or inability to arouse, and then any bluish in the lips or the face. Again, if any of that were to happen, we do want you to call your healthcare provider or the public health department. They will ask you to put a face mask on when they come to get you or when you come into the hospital, and that's just for your protection and for the protection of everybody around you. If emergency services are needed, please notify the dispatch personnel that you are being evaluated for COVID-19 or you have been evaluated, and then let them know of your symptoms. That way they can make sure they have everything when they arrive at your home. And then how has this affected the Winnebago community? Laura Gamble is going to go over those with you.
Hello, everybody. I'm Laura Gamble. I'm the Chief Operating Officer at 12 Clans Unity Hospital. I am a registered nurse, and I have my bachelor's degree in nursing. I have been at Winnebago for about 9 months now, and I have had over 30 years of experience in the nursing area and working with hospitals. I also have quite a lot of experience with emergency operations planning, and so this has been very challenging for everybody, and we just appreciate everybody listening to this today and really taking these things into consideration that we're talking about today. So how has this affected the Winnebago community? Currently, we have no positive cases reported within the Winnebago community. All 12 Clans Unity Hospital entrances to the facility is now limited to the east entrance. So that's the entrance by the emergency room. The front entrance is closed, and all other entrances are closed. All patients and now visitors and now employees will be screened at the door for possible COVID-19 exposure. Visitors accompanying patients are going to be limited, and actually, as of today, we are not going to allow visitors. We have got to decrease the amount of patients that are coming and visitors coming through the hospital. It is creating sometimes some issues, and so we are trying to do that, and we're trying to be respectful of that with everybody. We will put some guidance out on that in the future. All individuals with respiratory illness symptoms are required to wear a mask, and everybody's been really good about that, so we appreciate that. This includes the fever, the cough. We're even going to add sore throat, and of course, difficulty breathing. Patients really are asked to call the clinic or somebody before they come to the hospital so that we can screen them beforehand. There might be a time where you may not have to come to the hospital. We can tell you how to do some home care measures, and a healthcare provider can help you with that, or the public health nurses can help you with that. We're really trying to limit those people that come to the hospital so our emergency department doesn't get clogged, and there's a lot of people there, and so our providers can take care of those sick people that we need to take care of. The next slide is the 12 Clans Unity Hospital Emergency Department and what we're doing there. If you are experiencing mild illness, please call ahead to get guidance. We do not currently do random testing at 12 Clans Unity Hospital. We do not have the capacity to do that. There aren't any hospitals in the state of Nebraska that are just doing random testing. The emergency department is open as usual, but we are working on plans to care for increased numbers of patients. If we would get a large influx of patients with symptoms, we have plans to deal with that. If you come to the ED with respiratory symptoms such as a cough, shortness of breath, you will be asked to put a mask on. I know I keep saying that, but that's something that we really need you to do. And you will be placed in a special waiting room away from other patients, ones that don't have any respiratory symptoms. Because as you know, we still have patients that come in that have other ailments too that are going on. So what we're going to do with the pharmacy at 12 Clans Unity Hospital. The pharmacy is now temporarily filling 90-day supplies for medications for everyone. Starting Friday, 3/20, a temporary drive-through pharmacy will be in place at the front entrance or the south side of the hospital. Those pharmacy drive-through hours will be Monday through Friday, 8 a.m. to 5. If you have prescriptions you need to pick up, you should call ahead so the medications can be there for you and ready for you when you drive up. If you don't call ahead, it may take a little longer to get those filled, but you can wait in your car and we'll get them out to you. Staff will be wearing PPE for protection, such as a mask when they come out. Over-the-counter medications, such as ibuprofen or Tylenol, can also be obtained through the drive-through pharmacy. We've had people just coming to the emergency department because they don't have access to Tylenol or ibuprofen. And we really would like to limit that and have people come to the drive-through pharmacy to get that. Regular inside pharmacy hours will operate as usual, but again, we really want to limit the people that are coming through the hospital. Limiting the number of people in the facility is going to decrease everybody's chance of exposure. We need to keep our healthcare workers well too. Nobody has enough staff, and so we have to keep everybody safe. Staff in departments throughout the hospital and the health department are being rotated, and some staff are being put on telework or working from home or a leave status so that we can limit the number that are in the hospital. Additional supply orders have been placed, and we are monitoring existing supplies to make sure we have proper personal protective equipment for staff and masks for patients who need it. We have been doing that for weeks now. So our materials management people have been doing a great job at maintaining our personal protective equipment. I'm going to have Mona do the rest.
Thank you, Laura. Some of the things what you can do to prevent the spread of COVID-19, as we said, wash your hands for at least 20 seconds. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Try to avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Put distance between yourself and other people if COVID-19 is spreading in your community, and stay home if you're sick. Okay. So strategies to stay mentally strong. This time may cause anxiety, panic, worry, or fear. Share reliable information. Keep connections through social media, Skype, and phone calls. Practice self-care. Be mindful of assumptions. Check your facts with the CDC or the Winnebago Health Department's Facebook page or the 12 Clan Unity's Facebook page. If you are feeling overwhelmed with emotions such as sadness, depression, anxiety, or you feel like you want to harm yourself or someone else, please call 402-878-2245, the National Suicide Prevention Lifeline at 1-800-273-TALK, or the Nebraska Family Helpline at 1-800-866-8660, or the Winnebago Crisis Response Number, which is 712-259-3263, or during business hours, you can call the Behavioral Health Program at 402-878-2911. So since last week, we've been trying to put together all the frequently asked questions and see, those are some of the questions that we've received. So can people become infected with COVID-19 again? So at this time, unfortunately, there's just not enough information to determine if someone can be reinfected. How is COVID-19 treated? Not everyone will be required to have medical support care. Only those that have medical complications will require hospitalization. How long does COVID-19 stay on the clothes? At this time, it is unknown whether the virus can remain on clothing. TCUH is giving a 90-day supply of prescription medications. Will they run out? No, they have a good stock at this time. We've had questions about memorials or birthday meetings, and so we've advised people to try to hold off if possible, or have a very small gathering limited to maybe the immediate family only. Some asked what is going on with dental. So as of 3/18/20, the Winnebago Dental Services will be limiting to only emergencies only. The virus is aerosol and therefore more susceptible to spread during dental procedures. This step is being taken to protect our patients and our staff. If you have any questions, you can call the dental clinic. What is going on with optometry? At this time, we're only doing appointments and emergencies. There will be no walk-ins to keep the numbers to a manageable amount in the waiting room. What about behavioral health needs? We are available by phone and through in-person visits, whichever method each person feels comfortable with. The outpatient clinic also has e-Avera telebehavioral health services available. Contact the clinic to schedule an appointment. So thank you on behalf of our entire WCHS team. We appreciate your cooperation and efforts to keep our community safe and healthy. And with that, I'm going to introduce Esther Mercer, the Winnebago Tribe of Nebraska's CEO. Thank you.
Thank you, Mona. Good afternoon. I'll be speaking today about the tribal organization and the steps that we have taken to address the needs of the community and our tribal membership. The Winnebago Tribe of Nebraska is currently facing an unprecedented hardship, the likes of which have not been seen before in modern times. The Winnebago Tribal Council made the difficult but necessary decision on Tuesday, March 17th, to close tribal operations until March 27th. The tribal departments were faced with an enormous task of having to adjust their normal work processes and schedules within a very short amount of time. We would like to take this time to assure the community and our tribal membership that while tribal operations have ceased, the services that the tribal programs provide to the community and to our tribal membership are still available to you. Please go to the tribe's website, www.winnebagotribe.com, and there is a tab titled COVID-19 Info, which contains the links to several of our tribal departments' operational procedures during the shutdown, including contact information for the departmental staff. We ask the community to please bear with us as we assess the protocol that we've established and as we adjust our processes accordingly as the COVID-19 crisis evolves. Please refer to the website and to the tribe's Facebook page for the most up-to-date information and be aware that it may be revised frequently. The tribal administration is currently working to address the fact that the practice of social distancing may be the new reality of our daily lives, and the changes that we are implementing may need to be in place for some time. Our goal is to ensure the safety of our tribal staff and community while continuing to provide critical services for our community and tribal members. And with that, I will turn the mic over now to Dan Farringer from the Winnebago Public School. Thank you very much.
As we have talked about, this is unprecedented, and we've been trying to keep up, and about every hour it changes with something else coming out from the governor or from NDE or ESU. Earlier this week, the governor basically wants all public schools to be closed down this Friday and they'll reevaluate every 2 weeks. What that means is we are going to be closed through April 3rd at this moment, and then we'll reevaluate again. And during that time, we'll continue feeding like we're doing. It's been going real well with the food program. We had 306 call-ins today. We prepared 384 meals. We ran out. So we're going to prepare more meals to help those that don't necessarily get called in. And we'll keep putting out the alert now with the call-in numbers. And it's new to everybody, so as we go through, but it's been very successful. The staff at the school, we're doing preventive measures. As far as the pickup, you'll see mask on, gloves on. It's all sack lunches or box lunches. In the kitchen, we're doing the social distancing as best we can. Our classified staff right now are on duty. We're working with, waiting for some other information to come down on how we're going to handle that through this. But we're trying to keep everyone employed as we go through. And then the governor, this afternoon, as I was finishing up one call, got a call from Mr. James up in his office, the governor's press conference this afternoon. He just closed down Sarpy, Douglas, Washington, and Cass County schools for 6 to 8 weeks. What that tells, the feeling we're getting is that could be us also in the near future. We're not sure where we're headed, but we're going to reevaluate every 2 weeks. And that just came out. We're also going to have a board meeting Tuesday, March 24th, to discuss what we've done with the board, where we're headed, and what we have to talk about in the future. The board meeting will be live. We're going to try live stream it through Facebook, as it is open to the public. I'm also going to have Zoom accounts for the board members and the administration so they do not have to come in. It's something the governor allowed us to do through the end of May because of the COVID-19. We've taken many precautionary measures and will continue to take precautionary measures to help ensure the safety of the community. The custodial staff is hard at work. We're cleaning rooms. We're putting, because we do have some teachers coming in, so we're putting notes on door to make sure you wipe it down. We have Clorox wipes and everything possible. We have stuff on order, so we make sure we keep that up. The other thing we're also doing at school is putting together homework packets. Most of the K-6 should have it for this week. We'll be delivering those as those that didn't pick them up yet. The 712 will be getting theirs. All their work was supposed to be turned in today, so we can make copies and put them in packets. That's what some of my classified staff is working on right now. We also we're going to continue to try to improve the communication. Earlier this week, I sent out an updated from the Northeast Nebraska Public Health Department, and I'll continue to do that as much as possible when I receive those information notes and updates. At this time, is there any questions that coming from the school? We're doing the best we can. It's new, like I said, it's new to everybody, and we'll continue to help. But our main purpose is that our students have the opportunity to have a meal and have opportunity to continue learning as best we can.
Good afternoon. My name is Maya Beltran. I'm with Winnebago Casino Resort. I wanted to advise everybody of our status and what's going on at the casino. And we had to develop an emergency action plan like everybody else. This has never happened in our history of our time in gaming. So we didn't have a response for a pandemic disease until recently. We developed 3 scenarios, and we are prepared for all 3. As of Tuesday, March 17th, there was a declaration of public health a disaster emergency by Governor Kim Reynolds. At that time, with much deliberation and conversation with our tribal council, it was determined that we would follow the recommendations of the state of Iowa. All casinos were shut down at noon, March 17th until March 31st at 12 p.m. So the Winnebago Casino Resort decided to shut down for 2 weeks out of precaution and safety of team members and guests of the hotel and casino. Now, it's important to note that there are no cases of coronavirus, COVID-19, in our region and in the state of Iowa in the Siouxland area. However, we felt it was a precautionary measure and an ability for us to be safe and help stop the spread of COVID-19. We are monitoring on a daily basis any changes or progression that may happen, but our goal is to reopen on March 31st at 12 p.m. Before this, we were taking extra precautions, extra cleaning, extra disinfecting, training to educate our staff, training and education of our guests. We have signage throughout the property. We trained everybody on educating them on COVID-19 as well as proper hand washing and coughing techniques. So at this time, we'll monitor the changes and progression, and we'll keep you advised of the status of Winnebago Casino Resort. At this time, I'll invite up Brian Chamberlain from WGDC.
Good afternoon, ladies and gentlemen. My name is Brian Chamberlain. I am the CEO of the Winnebago Gaming Development Corporation. I'll take this time to read from a statement that we prepared earlier this week to our patrons, players, and customers. We wanted to drop you a quick line to let you know that, like all others, we are observant of the COVID-19 coronavirus dilemma. Just like you, we are monitoring the situation to ensure that we continue to provide an environment that is safe, clean, and fun for everyone. True, we are a place for food and fun, but we take the safety of our customers, patrons, and players and employees seriously. We want to assure you that we are doing everything we can to keep the properties as clean and positively hygienic as possible, even more than we normally do. We recognize that with working with cash, the level of cleanliness that we have to maintain on a normal basis is something that is accelerated from a normal business. And in our normal course of that business, it is standard operating procedure for us to maintain a level of cleanliness above and beyond a standard business, and we will continue to do that. A few things we are also continuing to do internally is all staff have been re-instructed to clean the areas within the properties as often as possible, including the machine services and food prep areas. All staff is also directed to ensure wearing gloves when handling and preparing any food items, and common surface areas such as door handles, counters, restroom fixtures, seating handles, machine buttons, and cash dispensaries are being wiped down even more and cleaned more frequently with our sanitizing solutions. In our efforts to keep our properties as safe and clean as possible, we ask that everyone visiting in the coming weeks realize that public health safety is a communal effort, and we appreciate your help. Washing your hands often, coughing into your sleeve instead of into the crowd, or just staying home when you're not feeling well are all things that we can do together throughout this worrisome time. We will all get through this together, we have no doubt. As COVID-19 plays out, we plan to remain open for business and look forward to your continued support for our operations, our staff, and in their duties, as well as our other patrons that share your visiting time and space. We also want to say our appreciation for those customers that have so far verbally stated their appreciation for our decision to remain open. It is because of you and your willingness to support what we do that we have made this decision. We enjoy entertaining you and providing a great food option during our opening hours. We will continue to monitor CDC and local recommendations on the virus and events, and will continue to update you on any additional changes as they may come about. With that, thank you for your kind attention, and let's try to remain vigilant in our efforts to remain a place that is fun and open, serving great food that comes from a place that is clean and healthy for all, with gaming machines that are clean, fun, and available. And we hope to see you soon. Thank you.
Good afternoon. My name is Sam Burish. I manage communications for Ho Chunk Inc. Our goal at this time is to be proactive about people's well-being and the continuity of our business operations. I have brief updates to share in 5 areas. Those are employee well-being, customer safety, maintaining operations, travel policy, and our next steps as an organization. For employee well-being, we have trained employees on identifying the signs of illness and best practices to reduce spread. We're regularly cleaning our work sites and also encouraging employees to clean their workspaces and individual office items. We're also making special arrangements for higher risk employees and screening visitors at reception areas. We're sharing information from official sources, including the Winnebago Public Health Department. For customer safety, I'd first like to talk about our Pony Express convenience stores and Sweetwater cafes. We know these businesses are important to the communities they serve, so our goal is to keep them operational in ways that are safe for our employees and our customers. In that spirit, our Pony Express locations will start reduced hours on Friday. The Sweetwater cafes are now carry-out only. Information on these changes is available on both of those businesses' respective Facebook pages and is also posted at the business locations. We are also increasing cleaning at those businesses and all other work sites, in addition to taking additional precautions. For the convenience stores, we are increasing our fuel orders as well as necessities to help keep the shelves stocked as best as possible. For the entire business, frequent executive meetings are taking place as well as ongoing monitoring of the situation. We are updating our crisis communications plan to ensure regular communications with all stakeholders, including the board of directors and tribal council. We are adapting procedures by office location, such as reducing in-person meetings. And we have also finalized a COVID-19 response plan. This plan includes office location closure procedures, self-isolation guidelines, telework requirements, and identifying essential personnel and chains of command. I have 2 remaining items to cover. One of them is our travel policy. We have eliminated all non-essential travel. Essential travel is being evaluated on a case-by-case basis with our executive team. Employees who've recently traveled to a high-risk area are self-isolating. We're transitioning to conference calls and online meetings whenever possible. For our federal government contracting employees, their travel is determined by contract requirements and is being reviewed on a case-by-case basis. Finally, I'd like to talk about next steps for the organization. Ho Chunk Inc. is continuing to adapt to individual and customer needs. We are working closely with tribal and other entities for guidance. We're enforcing sick leave and reporting policies and tracking the anticipating financial impacts. And we'll also continue our role as an advocate for Indian country in any upcoming federal legislation or programming that is passed. Thank you.
Aho. Good afternoon. My name is John Snowball. I'm the Vice Chairman of the Winnebago Tribe. And at this time, I would like to say, Pinigigi, Wainigi Napshana to each one of the people that have had a hand in ensuring the safety of our people during this historic event. And I want to ensure everyone that the Winnebago Tribal Council has come together to stand strong and stand tall with the decisions that we're faced with. And I want to encourage each one of our community members to look out for each other. Look out for your children and your loved ones and your elders. There is no easy decisions for us left, is what I like to say. That the easy decisions have been made for us. And that's why we sit here. And that's why we're all in this room, to ensure that we're safe and that we're moving forward and we're going to make it through this. So I would like to thank Garen for setting this up and ensuring that our people are well informed in a safe manner. Thank you.
So we do have a statement from the Little Priest Tribal College. All classes are online for this week. Employees are contacting students via phone and email to make sure they are continuing their work. All employees are working from home and are reporting their to-do lists on a regular basis. As of now, all classes are scheduled to start back on campus on March 30th. Little Priest Tribal College is extremely happy to announce that the focus visit was 100% successful, and we couldn't be more happy. Kudos to everyone. Please visit our Facebook page and website to keep up the developments at the college. We pray for everyone's safety. Thank you. No? Oh, good. Then we're done. So we have one more statement. Go ahead, Andrew.
There's one thing that we do want to put out to the community. If there is any travel outside of the Siouxland or the tri-state region, we do ask that you call the Winnebago Public Health Department hotline. That way we can evaluate anybody that has traveled outside to see if they were in a high-risk area and give them guidance as to what to do from there on. And that's starting today. So if anybody comes back within the community today, we do ask that you call that hotline, and then we'll walk you through any precautions that need to be taken place.
We would like to clarify the visitors that we are putting into effect today. And so I'm going to have Sarah, and I'll have her introduce herself, and she'll go over that with you.
Good afternoon. I am Sarah McIntosh, and I'm a nurse practitioner that works full-time at 12 Clans Unity Hospital. I have experience in over 19 years of emergency management, working in the emergency department, trauma, and emergency care. I've also worked in primary care clinics and worked with OC Health and work comp. So I just want to clarify any question about the visitor policy. This is obviously to help protect you as a community and us health workers to keep everyone well. If you are a minor and you would need one parent will be allowed back with you as a minor, so that would be a child under the age, a non-adult. If you are what we would call obtunded or have had loss of consciousness or unable to make any medical decisions for yourself, you will be offered one, or we will be asked to have one family member come back to help us workers to better understand the situation on why you're in the emergency department. So I want to clarify that yes, we are restricting visitors. However, we are still in need of a one parent for a child. And in the event that you would not be able to answer our questions to make the best choice on what our decision for your best health would be, we will be asking one family member to come back with those patients that meet that requirement. Does anybody have any questions about that?
Hello, my name is Emily Longuski, and I'm the Communications Manager for the Winnebago Comprehensive Healthcare System. At this time, we'd like to open up any questions that the community members may have. If you could please type your questions into the YouTube stream chat box or post them on Facebook. We do have members from the hospital and health department here available to answer those questions. Is there any questions in the room? Okay, so if you would like to leave any questions on the stream, we will do our best to get those answers and get back to you in a timely manner. I think that wraps up our live stream. Thank you all for tuning in.